So one of the places where specific upper cervical care can really shine is when it comes to these more complex and chronic difficult neurological conditions, whether that is something like multiple sclerosis or Parkinson's, Chiari Malformation, Trigeminal Neuralgia, Vertigo, all of these kinds of things. Oftentimes there's no singular cause or singular tried and true treatment or cure for these types of things. And so we often end up being a really great option for these types of people. In a lot of cases, they have been kind of all over the place to a variety of different specialists, just trying to get some answers and some help. And a lot of times by the time they reach us, the quality of life is pretty poor.
And very often what we find is that in the history of patients with these complex neurological conditions are significant accidents and injuries to their head and spine. And it may have been decades ago. But the problem is that research has shown that people that are in these whiplash injuries, it can really diminish and affect the health of the brain. And that's something that can, over time, lead to these more complicated issues.
One of the benefits of coming into an office like this is that we are certainly going to do a very thorough consultation, a thorough exam and imaging, but we also encourage these people to bring in any previous medical studies that they've had done. We'll look at them really through a different lens with a different perspective.
Either way, there are things that we evaluate when it comes to alignment and the venous drainage and the cerebral spinal fluid that unfortunately can get missed or overlooked by a traditional radiology review. So we encourage patients with these complex neurological issues, if they've had an MRI in the past, to bring that to a complimentary consultation here at the Revive Clinic for review.
And now that I'm aware of it, I can feel it more. Like if I get certain headaches, it feels like pressure build up and such.
Yep.
I'm finding different migraines happen at different points. So.
Yep. And you know, before getting under upper cervical care, what were some of the symptoms related to the Chiari and the spinal issue up there at the top? What were some of the symptoms that you were experiencing?
I have a lot of pain just in my neck, and it was always migraines in my neck. And I would go to my regular PCP, and they gave me all those migraine pills, but they never help because they focus migraines at the front of the head, and in the brain of mine, my headaches are caused because of like a neck pain more than anything.
Yeah.
Like it feels swollen and neck painish, and then it causes a headache.
The pressure goes
up.
from the bottom up. Yeah, yeah.
When we do our work, it's very precise and it's very gentle. So folks with more complex neurological conditions are safe in an environment like this because it's not going to overstimulate the brain. And with the precision and accuracy, it reduces the risk of flaring up the condition. Because some conditions, like Chiari Malformation, for example, is a very complicated neurological condition. If done incorrectly, the procedure can really agitate the spine and agitate the brain. But within upper cervical, the options that we provide are extremely safe and gentle, and so we don't have to worry about that as much in these cases.
On August 16th, I was playing soccer as a goalie for my soccer team, and I was kicked in the head when diving for a ball. I lost my ability to speak very quickly. I started to stutter. Then after developing a pseudo-seizure type deal, I lost my ability to walk. First, it was horrible. Like I never thought it was gonna end. I really thought that I was gonna live the rest of my life this way, and I was thinking about all my friends that I would probably lose in the future, and the friends that I lost when I got the concussion, and how I'd never get them back. Going to countless doctors, my mother met a friend of a friend who had a daughter with the same situation I was in, who went to Dr. Bulow. The first visit I got, the first adjustment, you could immediately tell that my stutter was disappearing. I could just think a little bit more. I could get thoughts out faster. And now that I've gone to him, my life has completely changed. People are talking to me again. I can focus. I'm going to school better. I'm getting better grades. I'm doing more work. I'm actually being active and hanging out with people again and continuing a normal life, which was what I wanted all along. So
I think it's really important for individuals with some of these chronic neurological conditions to get all of their options, because very often we will resign to just feeling like this is just the way it has to be. But I can promise you that folks with these sorts of issues, when they get into an environment like this in a precise upper cervical clinic and we work with them, very often they do see an improvement in their quality of life. And just improving is a very powerful thing for someone with a chronic diagnosis. And so I would encourage you, if you are dealing with one of these complex chronic neurological neurodegenerative disorders, to give yourself that hope. You deserve that. You deserve the chance to see if something can help you, and we would be honored to provide that to you. You can always call the clinic here and reserve a time to have a complimentary consultation and screening process to see if care could be right for you. Or if you're outside of this area, you can check our referral map or contact the office, and we can try and find you a specialist that is near your area. We wish you all the best and hope to help soon.